in the studio.
All right, thanks, Lisa. The city says as of Monday, more than 67,000 people in the 5 boroughs have gotten their first shots of the vaccine. That includes healthcare workers as well as nursing home residents and staff. Next up this week, urgent care workers who are treating COVID patients and the people who are actually giving out the vaccine. Now, even though they are among the first in line to get the vaccine, a number of healthcare workers in this city say they don't have access to the shots, so they're taking matters into their own hands and going out of state to get protected. Linda Schmidt live in the newsroom with more from local doctors who say they're being overlooked. Linda.
Yeah, I got a tip-off on this morning there, Steve. Some healthcare workers, including doctors, say despite all of the announcements here in the state about healthcare workers getting the vaccine here in New York, they do not have access to it. As a result, they are going to New Jersey and Connecticut in order to get vaccinated.
We are all desperate to get this vaccination.
Dr. Tayaba Ahmed works at Lenox Hill Hospital on the Upper East Side. She says she and many other healthcare workers who see patients face to face every day do not have access to the vaccines. So she and dozens of others are going to New Jersey and Connecticut in order to get vaccinated.
I'm going to New Jersey. It could be like April or May by the time New York pulls it together.
Dr. Sherry Sainuk is a pediatrician in Levittown, Long Island.
You can see I probably have these lines all over my face from the N95 mask that I wear about 8 hours a day while I'm seeing lots of sick children. I'm doing COVID testing.
She has a private practice in a private office.
We see multiple positive, COVID, positive children, and we're putting ourselves and quite honestly, our office staff as well at risk. And right now we do not qualify for vaccines in New York State. Despite the risks that we take every day.
Dr. Sainuk started a petition on Saturday urging Governor Cuomo to include all healthcare workers who see patients in person. So far, it has more than 2,900 signatures.
We are frontline workers who've been left behind.
Don't forget about the little people who are still seeing patients every single day in person.
Dr. Ahmed says New York has dropped the ball when it comes to healthcare workers.
How are they going to distribute this to regular people who are not in medicine and not in healthcare? Because if there's such poor planning within medicine, how are the truck drivers and the taxi drivers and the people who are not necessarily, the bankers, the people who are actually essential workers who are at grocery stores, who are seeing people every day?
Now, of course, also today we reached out to Northwell Health Systems, which Lenox Hill Hospital is a part of. Northwell responded saying that there is currently a limited supply of the vaccine and it's going to take time to vaccinate everyone. We also reached out to Governor Cuomo's office about 1:20 this afternoon. They said they would get back to me with an email by about 4:30. But so far, Steve, we have not heard back.
All right, thanks, Linda. Breaking